එදිනෙදා ඔබේ මුළු සිරුරටම රැකවරණයක්. සුදේශී කොම්බු සබන්.
ලෙන්ගතුකම වැඩි කරගන්න ලව්ජු රුපියල් 50 අඩු කළා.
මාමේ එන්න අපිට එකක් බොමු.
In your headlines tonight, relief in solidarity. President Gotabaya Rajapaksa echoes calls for debt relief from international donors at non-aligned online summit.
Need for debt relief and financial stimulus for these countries must be duly recognized.
Death and revival. Sri Lanka's 9th COVID-19 death reported as country prepares for gradual reopening. No sweat. Defence Secretary Major General Kamal Gunaratne says virus no longer a reason to keep country shut. Safe polls. Election Commission announces health and safety guidelines for holding elections. All this and much more coming up tonight on First at 9, this Tuesday, the 5th of May 2020.
69 SMS කර රුපියල් මිලියන 3ක මුල්තැන්ගේ උපකරණ දිනාගෙන අවුරුද්දෙම 100 ටයිම් සේව් කරගන්න.
From AdaDerana, this is AdaDerana First at 9. Live from Studio 24 in Colombo.
A warm welcome to all of you watching from home. This is Sri Lanka's premier English newscast on AdaDerana 24. We begin with your top stories tonight. President Gotabaya Rajapaksa, addressing the online summit of the non-aligned movement last evening, reiterated Sri Lanka's support for global appeals for the provision of debt relief and greater financial assistance to vulnerable countries by international financial institutions and donors, highlighting Sri Lanka's success in containing the spread of the virus, spearheaded by Sri Lanka's free healthcare system, which includes a well-established preventive mechanism. The President told the meeting that the government of Sri Lanka looks forward to sharing its experiences and successes with fellow members.
President Gotabaya Rajapaksa addressed the non-aligned movement's online summit last evening, held under the theme United Against the COVID-19, to promote international solidarity in the fight against the pandemic. Chaired by Azerbaijani President Ilham Aliyev, who is the current non-aligned movement chair for the 2019 to 2022 term, the summit was also addressed by President of the UN General Assembly, Professor Tijani Muhammad Bande, UN Secretary General Antonio Guterres, African Union Chairperson Musa Faki Mahamat, EU High Representative Josep Borrell, as well as Director General of the World Health Organization, Dr. Tedros Ghebreyesus.
Sri Lanka recognizes the timely initiative to establish a NAM task force to compile a database of basic humanitarian and medical needs of the member states to sensitize donors on urgent requirements. We commend the COVID-19 Global Humanitarian Response Plan and the establishment of the United Nations COVID-19 Response and Recovery Fund. Sri Lanka also supports the endeavors of the WHO, which has been playing a vital role in shaping the global response to the pandemic. Sri Lanka has been successfully containing and controlling the COVID-19 threat. Out of the total PCR tests conducted so far, only 3% has been confirmed as infected. The death rate is at a very low level of 0.97%. Sri Lanka wishes to share its experiences and successes in regard to the COVID-19 pandemic with fellow members. It is essential to ensure that all countries have unrestricted access to vital medical resources required to respond to this virus and do not face impediments in their procurement.
While reiterating Sri Lanka's support for global appeals for international financial institutions and donors to provide debt relief and greater financial assistance to vulnerable countries, President Rajapaksa also emphasized the need to recognize the critical and diverse economic and social challenges faced by middle-income countries.
As Sri Lanka notes the deep concerns that developing countries are facing, an unprecedented economic and debt crisis due to the pandemic, need for debt relief and financial stimulus for these countries must be duly recognized. In this regard, Sri Lanka reiterates its call and joins global appeals for international financial institutions and donors to provide debt relief and greater financial assistance to vulnerable countries. It is important to emphasize that middle-income countries too face critical and diverse economic and social challenges that have been augmented by this pandemic. Therefore, it is important to also focus on their needs at this particular juncture and accord the necessary financial support to avert negative income consequences. Sri Lanka believes that national and regional level initiatives complement and strengthen the global response to this crisis.
නිෂ්පාදිත දිනය කවදත් අලුත් වටවල තේ අරගන්න.
වටවල තේ ශ්‍රී ලංකාවේ තේ එක.
Sri Lanka lost another patient to the COVID-19 virus today, marking the country's 9th death, that of a 44-year-old mother of 5 and a resident of Modara. She passed away while receiving treatment at the National Institute of Infectious Diseases after being transferred from the National Hospital in Colombo earlier today. Meanwhile, with the detection of a COVID-19 patient from Bandaranaikapura in Rajagiriya, along with the identification of other residents exposed to him, health authorities took measures to temporarily halt movement in and out of the area.
Sri Lanka reported its 8th and 9th COVID-19 deaths on consecutive days yesterday and today. The 9th victim was a 44-year-old mother of 5 residing at the Metsanda Sevana housing complex in Modara, Colombo 15. Health authorities revealed that the patient had other prior medical complications, including a respiratory illness. She had been admitted to the National Hospital in Colombo when her respiratory condition worsened and had sought treatment on 2 occasions at private medical centres in her locality. Tests conducted at the National Hospital had then confirmed her as COVID-19 positive, resulting in her transfer to the National Institute of Infectious Diseases last night. Tragically, this afternoon she succumbed to the virus. Her final rites were carried out at the Kotikavatta cemetery in accordance with international safety regulations. Biological samples had then been obtained from the patient's husband and children for PCR tests to be carried out as a precaution. It was revealed that the victim's spouse is a bakery retailer and had sold to households in the area on the 28th and 29th of last month. Samples were also obtained from the family of the victim's eldest son's fiancée as well. Subsequently, 15 family members were then transported to a quarantine centre. Sri Lanka's 8th COVID-19 victim was a 72-year-old resident of Polpitigama in Kurunagala who succumbed to the virus yesterday. She too had a history of prior medical conditions.
ඇය කාන්තාවක් වයස 72 පොල්පිටිගම ප්‍රදේශයේ නාවික හමුදා ඥාතිත්වයක් තියෙන කෙනෙක්. ඇය හෝමාගම රෝහලේ තමයි ප්‍රතිකාර ගනිමින් සිටියේ. මේ COVID-19 තත්ත්වයට අමතරව ඇයට ඇත්ත වශයෙන්ම වහුගඩු පිළිබඳ කාලීන රෝගී තත්ත්වයකුත් තිබුණා. මේ සියල්ල හේතු කොටගෙන අවසනාවන්ත ලෙස ඇය මිය ගියා. නමුත් ඇත්ත වශයෙන්ම ඔය කියන ස්පාඤ්ඤය, ඉතාලිය, දකුණු කොරියාව, එක්සත් රාජධානිය, එක්සත් ජනපදයේ ඇතුළු ඒ සියලු රටවල් ගත්තාම ශ්‍රී ලංකාව තමයි අඩුම මරණ අනුපාතයක් පෙන්눔 කරන්නේ. මේ මරණ අනුපාතය 101යි. ඇතැම් රටවල් 113කට වැඩි මරණ අනුපාතයක් පෙන්눔 කරනවා.
The victim's final rites were also carried out at the Kotikavatta cemetery yesterday. With the detection of 11 new COVID-19 cases today, the total number of infections in the country stands at 762, out of which 540 remain active cases. Sri Lanka's total recoveries increased to 213 today, after 19 more patients were discharged after full recoveries. A further 145 suspected cases currently remain under medical observation. Meanwhile, following the detection of a COVID-19 patient in Bandaranaikapura in Rajagiriya, 29 residents from the area were transported to the Kandakadu quarantine centre. According to health officials, all 29 were confirmed drug addicts. Investigations revealed that elder brother of the patient too was addicted to drugs and had frequented several high-risk areas in Colombo during the curfew period. Following this, authorities quarantined the individual and 50 others who had associated with him along with their families. The COVID-19 patient from Rajagiriya is currently receiving treatment at the IDH after being transferred from the National Hospital in Colombo. Meanwhile, it was also revealed that the victim had attended a party held in a house in the area and also met with members of a sports club recently. Due to this, authorities were forced to implement measures to completely halt movement in and out of the Bandaranaikapura area. Meanwhile, a special grade nursing officer at the National Hospital in Colombo has also been infected with COVID-19. She was admitted to the Colombo National Hospital and was later transferred to the IDH. In the meantime, 46 residents of the Suduvella and Keselvatta areas who underwent quarantine at the National Hospital for Respiratory Diseases in Valisara returned home today. The group has been in quarantine for nearly 20 days and have been instructed to follow a further 14-day self-quarantine process at home. Meanwhile, the village of Pahalagama in Anuradhapura, which had been placed under isolation from the 26th of April onwards, was reopened today. Similarly, the isolation of the villages of Abepura and Somapura in the Lankapura Divisional Secretariat of Polonnaruwa too ended today. The area has been under isolation since the 22nd of April. The move came after a full disinfection of the two villages. Meanwhile, it has been over 7 weeks since Sri Lanka reported its first COVID-19 patient on the 11th of March. Since then, the 7th week recorded the highest number of cases, with 309 infected persons detected. 6 days into the 8th week, the country has recorded a drop of 133 COVID-19 patients.
කොරෝනා වෛරසය පැතිරීම වළක්වන්න සබන් යොදා දෑත් සෝදන්න.
Curfew was lifted once again this morning in 21 districts and reimposed again at 8 p.m. During the day, a marked reduction in crowds in thronging townships was noticed, with most people preferring to stay safe at home. Meanwhile, the President's Media Division issued a detailed clarification of how civilians are expected to return and resume life with the curfew in effect from the 11th of May.
The President's Media Division announced a detailed clarification on how the resumption of civilian life will progress while the curfew remains in force through a communiqué released last night. According to the announcement, the curfew will remain in effect in the high-risk districts of Colombo, Gampaha, Kalutara and Puttalam until further notice. Meanwhile, in the rest of the districts, the curfew will be lifted at 5 a.m. and will be imposed at 8 p.m. and this pattern will continue until Wednesday the 6th of May. The curfew, which will be reimposed in these districts at 8 p.m. on Wednesday the 6th of May, will stay in force till 5 a.m. on Monday the 11th of May. However, as the curfew remains in force, civilian life in the districts of Colombo, Gampaha, Kalutara and Puttalam will resume from Monday the 11th of May. Although this plan was scheduled to be implemented from the 4th of May, the date was extended till Monday the 11th of May due to the public holidays following this week. The communique adds that both public and private sector entities in the districts of Colombo, Gampaha, Kalutara and Puttalam are expected to recommence their work from the 11th of May. Further, heads of organizations have already been instructed to work out a plan based on their labor requirements. The heads have been requested to ensure strict adherence to the prescribed health guidelines issued to control the spread of the COVID-19 virus while carrying out their operations. Private sector organizations have been requested to open for work at 10 a.m. daily. The responsibility to decide which employees should report for work and their numbers lies with the heads of each organization. Further, buses belonging to the Sri Lanka Transport Board and railway carriages will only be permitted to transport public and private sector employees reporting for work. Civilians not designated as essential staff are requested to remain in their homes as a precaution. Meanwhile, members of the public remaining at home are only permitted to leave their homes to purchase essential goods such as food and medicines. People living in areas where curfew is in force will be expected to follow the NIC number system, which will be in effect from the 11th of May when leaving their homes. However, this system will not apply in areas where the curfew has been relaxed. Meanwhile, the curfew for 21 districts except Colombo, Gampaha, Kalutara and Puttalam was lifted at 5 a.m. today after the reimposition of curfew at 8 p.m. last night. Though the curfew was relaxed for 15 hours, providing a window of free movement, our correspondents island-wide reported a massive decline in the number of people frequenting towns. In the meantime, buses and trains commenced operations according to their daily schedules. Furthermore, the police carried out inspections on public transport services to check on whether safety protocols were adhered to. As the curfew remains in effect in 4 districts, The police and tri-forces, as usual, continue to crack down on curfew violators, those misusing curfew permits, and those not adhering to safety protocols in public. So far, 46,912 people have been arrested and 12,166 vehicles seized for violating the curfew island-wide from 20th March to date. Meanwhile, the second stage of a program to assist members of the public stranded and unable to return home owing to bans on inter-district travel commenced this morning at Mirihana. A total of 700 people stranded within 15 police areas coming under the Nugegoda Police Division were gathered at the police grounds in Mirihana awaiting transport to their homes. The travellers were first disinfected and their body temperatures checked before departure. Meanwhile, a further group of 80 people stranded near the Kotte Municipal Council area and unable to reach their hometowns assembled at the Vadikada police station grounds today. The personal information of the travellers was obtained and their health status checked at the premises.
With the country moving gradually towards resumption of normalcy, economic relief services for low-income groups, such as the distribution of government's 5,000 rupee relief allowance, pensions, other allowances, continued in many parts of the country today. The government announced that the second round of distribution of allowances will run from the 11th of this month to the 15th of May and will cover a broader list of beneficiaries.
A decision has been made to commence the second round of the distribution of the 5,000 rupee relief allowance from the 11th to the 15th of May. This will include beneficiaries included in a list of permanent beneficiaries, priority lists and those recommended by rural committees. In this backdrop, residents representing 50 families in the Kahatapitiya Grama Seva division protested outside the Grama Nidilari office today. The reason for the protest was the non-payment to them of the 5,000 rupee relief allowance. Further, it has been decided to distribute agrarian pensions from 11th May onwards. The Agrarian Insurance Board has announced that beneficiaries can utilize their farmers' pension cards as curfew permits. Meanwhile, the successful payment of May pensions was witnessed in many areas throughout the country. Many beneficiaries commended the early payment of pensions before the regular due date tomorrow. Although pensions, senior citizens' allowances and kidney patient allowances were promised today, beneficiaries in Eppavela as well were left waiting. Meanwhile, a meeting chaired by Minister of Health, Pavitra Vaniyarachi, was held at the Health Ministry to discuss the reopening of beauty salons throughout the country. At the meeting, discussions centered on the need to only permit essential services such as haircuts, albeit in accordance with instructions from the Ministry of Health, while maintaining adequate space, the list of health and safety precautions compiled by the Ministry, and the monitoring of such operations by the Office of the Medical Officer of Health. In the meantime, public health inspectors in the Wattala Municipal Council area carried out inspections of shops and factories in operation in the area to determine if health and safety precautions were being followed. Although most factories were seen following the government-mandated safety measures, shops, however, were less keen on doing so. During the inspections, PHIs also detected a stock of expired goods on sale in a shop in the area and filed legal action against the shop operator. Meanwhile, an awareness campaign was carried out at the Rathnapura Teaching Hospital to educate patients visiting the outpatients clinic on the dangers of the COVID-19 virus.
COVID-19 coronavirus Chairman of Elections Commission Mahinda Deshapriya announced a list of initial recommendations made by the committee appointed to make recommendations for health and safety measures to be followed when elections are held. In the meantime, the Supreme Court called for the hearing of a fundamental rights petition filed demanding the dismissal of the Gazette notification declaring elections on the 11th of May.
In the face of the country's battle against the COVID-19 virus, health officials and the officials of the Election Commission convened a meeting on the 20th of April to discuss the possibility of holding the parliamentary elections. The objective of the meeting was to discuss safety measures that should be followed if the election was to be held before the COVID-19 pandemic subsided. Accordingly, a committee was appointed to discuss the matter and make necessary recommendations. The committee, comprised of specialists in epidemiology, officials of the Election Commission, the Senior Deputy Inspector General in charge of elections, the Director General of the Disaster Management Centre, the Additional Secretary to the Ministry of Public Administration, and a representative of the COVID-19 Task Force. Accordingly, the committee has already submitted several recommendations. Speaking to AdaDerana, the chairman of the Election Commission, Mahinda Deshapriya, said that the committee has recommended the maintaining of social distancing, regular hand washing and the use of gloves during elections. The committee has also recommended the use of face masks as well as using polythene dividers to maintain social distancing of members of the public when they cast their ballots. These recommendations will form the basis under which the health and safety guidelines for the election will be implemented. The Election Commission chairman added that these recommendations will remain in place for use during elections until an effective vaccine has been developed or the threat of the virus permanently subsides. He revealed that the Election Commission will receive the list of initial recommendations compiled by the committee on the 12th of this month. Meanwhile, the Supreme Court has ordered that a fundamental rights petition filed by attorney Charitha Gunaratne requesting the nullification of the Gazette notification issued by the Elections Commission declaring the election be heard on the 11th of this month.
The virus is no longer a reason to keep the country shut, the Defence Secretary says. We'll talk about that when we return after this break. Defence Secretary Major General Kamal Gunaratne says the success of the country's strategy lies in using the country's intelligence services to determine the path of the virus instead of running behind it. He said that although care must be taken with the virus still alive and kicking, that alone is not reason enough to shut down the entire country. Speaking on the Easter attack investigations, the Defence Secretary meanwhile pledged to uncover all those who supported, influenced and attempted to cover up for the attackers and bring them to justice.
Defence Secretary Major General Kamal Gunaratne says that Sri Lanka's mechanism to combat the COVID-19 virus is well prepared to deal with any number of virus hotspots that crop up in the near future.
අපි වෛරසයට පස්සෙන් දුවන්න ගත්තොත් වෛරසය ඉස්සර වෙනවා වෛරසය දිනනවා. වෛරසය යන්න තියෙන්නේ කොතනද කියලා අපි අපේ බුද්ධියංශ මාර්ගයෙන් හඳුනාගෙන අපි එතෙන්ට ගිහිල්ලා සැලසුම් කරපු යාන්ත්‍රණය එතන ක්‍රියාත්මක කරා නම් වෛරසය එනකොට අපි සූදානම් වෙලා කරන්න ඕන දේවල් ඔක්කොම කරලා ඉවරයි. බලලු 40 ගාණක් මට මතක විදිහට ඇති වුණා. නමුත් ඒ හැම එකම අපි හරියට හැන්ඩල් කරා. එහෙනම් ඉස්සරහටත් වලලු ආවා කියලා මෙහෙමයි අපි පරිස්සම් වෙන්න ඕනේ වගකීමෙන් කටයුතු කරන්න ඕනේ. නමුත් රට වහලා තියන්නේ ඒක හේතුවක් නෙමෙයි. මේ 11 වෙනිදා මේ රට අරින එක එකපාරට ඔන්න ඇරියා දැන් ඔක්කොම දැන් කලින් වගේ තමයි ඕන දෙයක් කරන්න ඕන දෙයක් යන්න එහෙම එකක් නැහැ. මේ විවෘත කිරීම 11 වෙනිදා වෙන්න තියෙන දේ යම් කිසි ක්‍රමවේදයකට අනුව ක්‍රමානුකූලව ටිකෙන් ටික විවෘත කිරීමක් තමයි වෙන්නේ. යන්න තිබිච්ච ඒවා හරියට ගිහිල්ලා නැහැ.
The Defence Secretary also pledged to leave no stone unturned in investigating all hidden figures behind the Easter Sunday attackers.
විශ්වාසයෙන් කියනවා මේ රටේ ආරක්ෂක ලේකම්වරයාගේ විදියට ඒ යුතුයකම අපි ඉෂ්ට කරනවා. කවුරු හරි මේ පරීක්ෂණ වලට බලපෑම් කරා නම් ඒ අය කවුද කියලාත් අපි හොයාගන්නවා. ඒ අය මේ තත්වයට ගෙනාවේ කවුද? දිරිගැන්වීම දුන්නේ කවුද? ඒ අයට මුදල් කවුද එව්වේ? කොහෙන්ද මුදල් ආවේ? මේ අය පිටිපස්සේ හිටපු මිනිස්සු කවුද? ඒ හැම දෙයක්ම හොයාගන්නකම් අපේ පරීක්ෂණය ඉවර කරන්න.
Former TNA parliamentarian M.A. Sumanthiran says that political differences should be of least interest in the current context and called for parties to work together while putting aside differences. He made these comments to media following a discussion with Prime Minister Mahinda Rajapaksa yesterday.
A discussion between Prime Minister Mahinda Rajapaksa and former TNA parliamentarians took place at the Prime Minister's official residence at Vijayarama Mawatha in Colombo last evening. The discussion was also attended by the national organizer of the Sri Lanka Podujana Peramuna, Basil Rajapaksa, and the chairman of the SLPP, Professor G.L. Pires. Former TNA parliamentarian M.A. Sumanthiran expressed views to media on his way out.
ආණ්ඩුක්‍රම වැස්සාව යටතෙන් අපි ක්‍රියා කරන්න ඕනේ. පාර්ලිමේන්තුව නැවත රැස් වෙන්න අත්‍යවශ්‍යයි. ඒකට අමතරව දැන් උතුර නැගෙනහිරේ තියෙන විශේෂ ප්‍රශ්න කිහිපය සම්බන්ධව අපි දැන් සාකච්ඡා කරා. ඒවට විසඳීමක් දෙනවා කියලා අපිට පොරොන්දුවක් දීලා තියෙනවා. සිරකරුවන් ගැනත් අපි කතා කරා. political prisoners අවුරුදු 15-20කට වැඩි කාලෙ ඉන්න අය මේ වාතාවරණයවත් ඒගොල්ලන්ට සහනයක් දීලා ඒගොල්ලන්ව නිදහස් කරන වැඩපිළිවෙලක් හදන්න කියලා අපි ඉල්ලා සිටියා. ආගමතුමා කිව්වා ඒක බලන්න ඕනේ දෙයක්. ඒක ගැන ජනාධිපතිතුමාටත් කතා කරලා අපිට හොඳ පිළිතුරක් දෙන්නම් කියලා පොරොන්දු වුණා. අපේ දේශපාලන මේ ස්ථාවරයේ ඔක්කොම පැත්තකට තියලා අපි ඔක්කොම එකතු වෙලා මුණ දෙන්න ඕන ප්‍රශ්නයකට දැන් අපි ඇවිල්ලා ඉන්නේ.
US Ambassador to Sri Lanka Elena B. Taplitz called on Prime Minister Mahinda Rajapaksa this morning in Colombo and discussed a host of issues, including the fight against coronavirus pandemic, post-COVID economic challenges and ongoing collaboration.
US Ambassador to Sri Lanka Elena Teplitz, in a meeting with Prime Minister Mahinda Rajapaksa, discussed the government's COVID-19 efforts and challenges the country faces in a post-COVID-19 economy. During the meeting, Ambassador Teplitz expressed hope that the public health situation in Sri Lanka gets better and reiterated the United States' wishes to remain a steadfast partner to the Sri Lankan government. Prime Minister Mahinda Rajapaksa requested the ambassador to facilitate assistance for the country's apparel sector, which is now manufacturing personal protective equipment to help meet the global demand. The US ambassador agreed to follow up on the request and informed the Prime Minister that the embassy is already working with companies in different sectors to connect them with buyers in the United States. She added that the United States would like to see Sri Lanka's multinational companies as well as SMEs successfully overcome the crisis. The delegations also discussed upcoming elections in both countries and pending projects that the two countries will follow up on as soon as the COVID-19 situation is under control.
AdaDerana continues to provide relief services to people affected by the ongoing curfew in place to prevent the spread of COVID-19. Now, the relief program, conducted in partnership with Dialogue, has distributed near 51,000 parcels of dry rations to temples, churches, mosques, children's and elders' homes. The program with Dialogue will be carried out in the future as well. AdaDerana also donated safety equipment to the General Sir John Kothawala Defence University Hospital. And we'll talk about the business community affected by COVID-19 when we return after this break. With many businesses facing intense hardships stemming from the global economic downturn following the coronavirus pandemic, the government commenced the collection of information on local businesses affected so far. Now, in this backdrop, the Commissioner General of Labour, Vimala Veera, has announced that the deadline for collecting information regarding local businesses and institutions and enterprises affected by the coronavirus pandemic has been extended up to the 15th of this month. The announcement added that steps have been taken considering the positive response received from the business community in providing relevant information regarding their institutions facing hardships from the economic impact of the virus. Business owners are requested to visit www.labordpt.gov.lk to submit their details in this regard. Now, taking you to global stocks, Asian stocks rose today, tracking a late Wall Street rally as governments eased coronavirus lockdowns, while oil extended gains on expectations that fuel demand will begin to pick up. In reduced trade, the Chinese, Japanese and South Korean stocks on holiday. Australia's ASX 200 rose 1.26% and Hong Kong's Hang Seng climbed 0.66%. Meanwhile, US stock futures rose 0.75%. The rally followed late US gains, with S&P 500 ending up 0.42%, driven by technology names including Microsoft, Apple and Amazon. Their strength overcame drops in airline shares of between 5% to 8% after legendary investor Warren Buffett said that his Berkshire Hathaway had sold its carrier holdings. MSCI's broadest index of Asia-Pacific shares outside Japan rose 0.56%. The upturn came on more optimistic statements from the governors of California and New York on reopening businesses. And oil prices climbed in early trade today, adding to gains in the previous session on expectations that fuel demand will begin to pick up as some US states and nations in Europe and Asia start to ease coronavirus lockdown measures. West Texas Intermediate crude futures rose as much as 8.2% to a 3-week high of $22.06 and were up 7.6%. US benchmark is on a 5-day winning streak that started on the 29th of April. Brent crude futures hit a high of $28.37 a barrel in early trade and were up 4.1% to $28.32, posting rises for a 6th straight day. Prospects improved for fuel demand as some United States and several countries, including Italy, Spain, Portugal, India and Thailand, began allowing some people to go back to work and opened up construction sites parks as well as libraries. With Saudi Arabia, Russia, other major producers and companies slashing output, the market shrugged off a decision by the Texas energy regulator to cancel a vote on mandating a 20% output cut in the United States' biggest oil-producing state. And the death toll in the United States and the United Kingdom have shown no sign of reducing due to COVID-19 as per data recorded in the past 24 hours. The United Kingdom, meanwhile, overtook Italy as the worst hit country in Europe, recording 32,313 deaths so far.
With no indication of a reduction in deaths being reported from the United States, 1,324 fatalities were added to the country's overall fatalities, taking its total to 69,921. As the risk of the virus continues to loom over the country, the college life of students have taken a drastic change, as roommates are currently being assigned based on coronavirus antibody tests. Colleges across the US emptied dormitories and moved classes online in March as the pandemic worsened, a decision that left many students clamoring for partial refunds, bringing to light another problem. Meanwhile, the United Kingdom has overtaken Italy to report the highest official death toll from the new coronavirus in Europe. Figures released today show that there have been more than 32,000 deaths in the UK alone. Weekly figures from Britain's National Statistics Office added more than 7,000 deaths in England and Wales. This raises the total for the UK to 32,313. Meanwhile, Italy and Spain today saw their daily death tolls recorded fall below 200. Both countries currently stand with infections over 200,000.
And that wraps up tonight's edition of First at 9 on AdaDerana 24. Thank you for watching. Stay safe. Good night.